Get started. So welcome everyone to our population health webinar. Thank you for taking the time out of your day today to join our session. I'm presenting here today as part of our Amazing Charts family of products as part of Harris Healthcare, a $215 million group delivering practice management, EHR, and population health products alongside revenue cycle management and other professional services. And I'm here today to talk to you about your patients viewed in a different way. So as a population rather than viewed as individuals. And I'll expand on that shortly. So before I get into that, I'll give a little bit about me. My name is Ben Scarf. I'm the Director of Client Support for our Amazing Charts group, and that spans the product groups that we had listed on the previous slide. My background is in management and finance at Harris Healthcare, and I've been with the company for a little over 4 years now. Today, I'd like to discuss the topic of population health and the importance of managing your patient population as a whole. The purpose of this session is mainly to inform you and to get you thinking a bit differently about your patients in the context of our evolving healthcare landscape. So I'd like to provide some insight into the methods that can be used to analyze your patients as a population. As healthcare professionals, you're experts at analyzing your patients as individuals, but you may require different tools to empower you to look at all your patients at once. So I'll be talking a little bit about how we can leverage electronic medical record systems to do just this through software. And then finally, I'll open up the call for questions. I'm expecting to go a little bit under here, so we should have plenty of time to address any questions or thoughts that you may have on the subject. So here on the slide, we have a few quotes and definitions for population health. And you can see, if you take a minute to read through these, that the common theme here is better clinical outcomes for a group of individuals. So in the context of your practice, this simply means providing better care for your patients, with the caveat of viewing them as a group rather than as individuals. So many of you have hundreds or thousands of patients, and you deal with each patient individually. Given the complexity of their individual issues and their medical history, it's impractical or nearly impossible for you to do something to improve the health of all your patients simultaneously. The clinical outcomes of your patients are really limited to the care that you deliver to them individually. And you as healthcare professionals are really limited to delivering care to the individual in front of you at any given time. Regardless of this individual care limitation, the landscape of healthcare today is shifting away from fee-for-service towards value-based reimbursement. We are seeing the evolution of programs like the Merit-Based Incentive Payment System, or MIPS. So while your attention and ability are limited to delivering individual care, you certainly want your overall patients to be as healthy as possible. And the industry reimbursement systems are gravitating towards this and aligning with this. So the concept here is to view your patients at a bird's eye view to ensure that the patients who have the highest risk are receiving the appropriate and necessary care. Many practices today are simply unable to proactively identify and address the needs of their patients due to bandwidth constraints. You're limited to treating and providing care to the patients who come to you with their concerns and their health issues. Generally, you can only treat someone if they are coming forward to ask for your help. And EMRs work consistently with this individualized focus. They're rightfully designed around the individual patient encounter. However, now as the industry is moving towards this more population focus rather than the individual focus, we're seeing the huge underlying benefit of EHRs in storing all of the aggregated data of all of those individual patients for us to pull together and view and analyze as a whole. So a population health tool should crawl through that patient data and highlight the higher risk and chronic patients for you to devote your individual attention to. The purpose of this is to help ensure that the patients in your population who really need your attention are the ones receiving it first. So conceptually, what you want is something that'll look at all of your patients as a whole and then identify the patients who need your help. Beyond that, the tool should give you the means to reach out or engage those patients so that you can deliver the care that they need. So the first question is, how do we identify who needs care? So one way is we actually have a framework right now that can help us define the patients that need your care in the form of the clinical quality measures, or CQMs, as defined by CMS. So based on that, one way to define the need for care is through care gaps that would identify whether a patient qualifies for a given clinical quality measure. For example, one CQM is to ensure that children over the age of 2 have received all their required vaccines. Any child who is missing some of these critical vaccines would be considered a patient that is in need of care. Another way to define patients in need is simply through their number of chronic conditions, or the amount of time that has lapsed since their last appointment. With respect to these patients, Medicare has given us plenty of guidance. Any patient with 2 or more chronic conditions is eligible for billing of chronic care management every month. So Medicare has defined these patients as people who need additional care. Ultimately, the best person to identify which of your patients need your help is you as the practicing healthcare professional. So to that end, a population health tool should simply empower you to view your patient population in aggregate. Next, ideally, this tool should empower you to take action on those patients. Once you've identified the patients that you want to bring in for appointments, what comes next? Naturally, in our individualized care framework, one might be inclined to picture looking at a list and picking out a patient who's unhealthy so we can then call that patient and then bring them in. But obviously, this idea breaks down immediately as it's impractical due to the very real time constraints that you and your clinical staff and your support staff face every single day. So ideally, the solution should also have some sort of way to do mass outreach. So for example, if you identify 100 patients who have, for example, 3 chronic conditions, and they haven't been to the office in 3 months or more, you want to be able to push a button and send them all an automated phone call or text message letting them know to come in. So now that we've discussed the concepts of what should be in a population health software, let's take a look at what that might look like. So first, you'd want a high-level view that's customizable so you can skim very quickly to determine which subset of patients you need to focus on. So for example, this practice has selected to view patients with care gaps with respect to diabetes clinical quality measures. So we can see that in the top middle here, and as well as patients with chronic conditions who have not recently been to the office. So you'd want all this to be fully customizable, right? You want to be able to change which conditions are coming up to you in your dashboards, which things are the focus of your practice and are most important to you. And then you'd want that to be fully customizable so you can change, what are the parameters. For instance, here we can see chronic patients not seen in the last 120 days. And I'm looking at the bottom middle graph. That you want that to be customizable, change it to last 60 days, last year, depending on, you want to get that to a manageable subset of patients for you to then outreach to. And then you also want to be able to click through that to see those individual patient lists. So next, we'd want to see here the care gap view, identifying how many patients have specific care gaps. And this is, with respect to the CQMs that I was describing earlier. So you can then drill down to identify which procedures are required in order to address those care gaps. So as an example here, we can see on the right, this practice has 618 diabetic patients who have gaps in their documented care in order to fulfill the requirements of the diabetes clinical quality measures. We can see 605 patients have a need to document blood pressure readings, and for most of them, we have a requirement for blood work to look at cholesterol and blood sugar, as well as a urine test and some vaccinations. You can then click through to see the names of each of those patients in the lists, and then you could then go further to click a button to schedule calls or text to each one of them. These 618 patients need care. They need help, but many of them may not be attentive enough to their own health needs. They may know, they have some concept that they need care, or they need to, I have to go take care of my diabetes, I got to go see the doctor, but they don't have the clinical knowledge to understand exactly what and when they need these things. And that is where the practice can better manage their needs. So once we've identified that 600 patients that has a need for care with respect to their diabetes, what do you do next? So again, the first step is to have those 600 patients, and that's a big step, just identifying who are those 600 people. The next step is that the population health tool should make it easier for you to then get in touch with them. So at this point, once you've identified that list of 600, you could have a member of your team reach out to each patient individually. And for many practices, this would be effective. This is where the solution is effective for many practices. But for many, that may be impractical or impossible simply because the front desk staff is already busy registering incoming patients, managing schedule, doing billing work, or any other number of tasks. So therefore, there should be an option to perform automated outreach. So you could simply type in your desired message and hit a button to generate automated phone calls or text messages to each of those 600 patients, asking them to call the practice to schedule an appointment. So here what we can see are the initial outcomes of such a campaign. And this is live data, but we scrubbed it for any PHI. So here we can see automated calls made to patients showing the time called, the duration of the call, and the type of answer. So we've talked a lot about clinical measures, and if the CQMs are a focus of your practice, you're also going to want to be able to check your compliance with those measures at a high level to ensure that you're compliant with enough measures to secure your incentive payments for the year. So here you can see real-time performance against individual measures, and you can click through to see the patients who are outliers for each individual measure so that you can address those gaps in care and bring those patients into the measure. You can select specific measures to track in the care gap view, which we looked at before using the diabetes example. So you can customize that view to track only the measures that are relevant to your practice and that you are targeting to satisfy. Now, as many of you are likely aware, Medicare offers reimbursement for 20 minutes of monthly chronic care management for patients who have 2 or more chronic conditions. This is an area of significant potential impact for both the practice and the patient. These high-risk chronic patients can receive personalized care every month, resulting in better clinical outcomes for the patient. The practice can administer that care remotely by the phone or through a patient portal, and this can be administered by any healthcare professional in the practice, including physician's assistants or nurses. The service need not be delivered by the physician themselves. So in order to manage these chronic patients, we need to identify the population of eligible patients with 2 or more chronic conditions and who are on Medicare. And I'll also mention at this point that other insurance payers are starting to adopt this. Medicare is, obviously leading the charge, but we are seeing other payers take some interest in this. And then beyond that, beyond identifying that eligible population of patients, you then have the subset of those patients who have upcoming appointments. And these can be enrolled in chronic care management when they next come into the office. Finally, we'd have a list of currently enrolled patients and the list of patients who need to have their care plan reviewed and billed out each month. So here we have some detail from CMS regarding qualification for chronic care management, as well as the definition for a care plan. So we can see here it's anyone with multiple chronic conditions, 2 or more, that are expected to last at least 12 months or until death of the patient. And the care plan consists of a few of the things listed there, including the problem list, the expected outcome and prognosis, as well as measurable treatment goals and a few other things. So the idea here is that every month you're simply calling the patient, having a 15 to 20 minute phone call or a few checkpoints throughout the month, and then documenting that. And then that's something that you can bill out every month without having to have that patient come in and take an appointment slot or take up space in the clinic. So to summarize what we've gone through, by managing your patients as a group, rather than as individuals, you can promote better outcomes for your patients by targeting the ones who really need help. You can drive higher revenue in your practice by filling open appointment slots or by specifically spending more time with patients who are higher risk and who are going to drive incentive compliance and higher reimbursement. Finally, by automating your patient engagement, you can also potentially save time and effort for your clinical support staff. In review, the industry is shifting and is placing more value on proactive care management to ensure a higher quality of care for the patients who need it. The concept of population health is based on leveraging the data stored in your EMR for your practice as a whole and using that data to identify and gauge the patients who are in need. So to close, we do have a tool that addresses those needs, and the examples and screenshots provided are all directly out of that tool. And you can feel free to reach us or visit our website to learn more at amazingcharts.com. And at this point, I'll take some time to address any questions that have come up in the chat. Please feel free to type in any questions you have. You can use the chat function or the questions function in the webinar panel. So I'll just check here if we have any. I'm not seeing, oh, here we go. I just gotta make this a bit bigger. Copy of the slides, absolutely, we can do that. Let me see if I can make this a little bit bigger for myself to read. Questions, there we go. So we have a couple questions about the cost, so that's something that we can reach out to and give you individually, and we can discuss more. This capable already exists. Does this capability already exist in 9.4.2? It does not currently exist. I believe this is regarding Amazing Charts 9.4.2. It is coming in the next release. Our next question. Can I already do this and pull patient reports in my current EHR? So some of our EHR products have CQM reporting functionality, but not a complete population health module. Our Care Tracker product does have the full this module and currently available, and Amazing Charts will have it in the next release. So in 10, we do this through Prime. How does this differ? So I'm not familiar with the Prime product, but I'd love to get in touch with you after, and we can talk directly about what functionality that product offers. This is in version 10.1 is where it will be available. And with respect to cost, we'll be rolling that out in further notifications, so we can certainly discuss that further. Let's see, and how easy is it to get started? So the population health product has a number of individual components which can be used together or individually, and you can actually reap pretty significant benefits from using any one individual piece. So for instance, the chronic care management module is pretty easy to use, and that can have pretty significant benefits just from using that module alone, or simply using the patient engagement piece, or simply running the queries or using the dashboard to identify subset of patients, which then you could use the automated outreach, or you can simply look at those patient lists and do manual outreach, or as they come into the clinic, you can talk with them. How does the module address CCM? So the way this product addresses CCM is it will crawl through your patient data to identify any patient who has Medicare as their payer, and then will also has 2 or more chronic conditions. So those patients meet the definition of a chronic care management eligible patient per Medicare. So it'll give you that list of patients of everyone who's eligible, and then it'll also give you the list of patients that have upcoming appointments and when their appointments dates are. So the idea there is you can simply, the front desk can print off those lists and highlight the ones coming in for the next week. And then the idea is that the physician would explain chronic care management, explain the program, which essentially consists of explaining the fact that only one provider can bill per patient for chronic care management each month. So the idea is, if it is your patient only, that the patient would need to understand they wouldn't have multiple other practices doing this for them. And then giving them access to a patient portal. And then you just need to document that conversation in the EMR. And then from there, you within the chronic care management module, it's simply a matter of clicking a couple of buttons to identify that you've done that, and that patient will come into your enrolled patients list. So from there, you just have a list every month. It refreshes to say, here's the list. You have to review each of these patients every month. So then every month, the physician or any clinical support staff would administer that plan, which means calling the patient, walking through, whatever the care plan may dictate, right? Depending on their conditions. And care plans vary across numerous different conditions, right? You can have behavioral health care plans, as well as care plans for any chronic condition you could think of. When is the system going to be launched? So for Amazing Charts, if I'm not mistaken, it will be available sometime this summer, or early fall at the latest. And it'll be available in 10.0.1. So I have a question here. Isn't this being more done at the hospital level? So population health is certainly something that's, it's become an emerging concept in hospitals first because there is a larger patient population there, obviously, to address. But as many of you can likely relate, even for a 1 to 2 provider practice, it's simply not possible to review all of your patient data in aggregate, right? There's just too many of them to really look at all of them at once and make sure that you're capturing every patient who needs that level of care. So there's certainly significant benefits for it at the practice level, and the solution that we have is very it's very affordable. It's very accessible. This isn't like a huge thing that where there's a big barrier to entry, that it's only hospitals that can participate in this. And really the revenue gains for a practice are pretty significant because you can use the patient outreach piece, which is I think our patient outreach is like 20 cents per phone call, or 10 cents per text, something like that. It's very little, and you can use that to fill open appointments and drive more utilization and higher revenue for the practice every month. So even for very small practices, it's still a very powerful tool. Does this need hiring another person to go through this data? So that's a really great question, because certainly the time constraint here for a practice is probably the most, the thing that we have to be most sensitive to. And I don't have a slide on this here because really we didn't want to focus this session on our product. The idea here is that this session would be mostly an information session about population health in general. But with respect to our product, we do have a sort of suggested timeline where we recommend, starting with a small component of the product and only taking, 5 to 20 minutes on the first day to just review the data and look at a high level at the patient lists. After you've, established those patient lists, it's simply a matter of, it's really very quick. It's a couple of button clicks, and then putting in the phone number for callback, and then making sure that you're comfortable with the message that's being sent out, and then another click, and you can automatically send it out to any list of patients that you're looking at to have the patient outreach going. So I would say that for many practices, you may have support staff who are calling patients and doing scheduling tasks and things like that, who could much more effectively put 5 to 10 minutes in and set up an automated outreach campaign and then divert their attention to other tasks. So I'd say that in general, for the vast majority of practices, this would not require an additional head to actually, go through the data and benefit from it, because so much of the tool is based around automation. The idea is pulling up these patient lists, but then you're not going to actually go and look at every individual patient. It's simply looking at, for instance, the patients that are coming in today, and then highlighting a few of those so that you remember that when those patients come in, to speak to them about chronic care management, for example, or to address their care gap that they need to have lab results ordered or something like that. So does the module prepare the care plans under CCM? So the preparation of the care plans is not part of this software. So that is still a piece that would be expected to be done by the physician. And the reason for that is that there is, certainly more complexity in addressing individualized care plans based on the interaction of medications, as well as, the individual needs and their individual medical history. I see one person who's having audio issues. Unfortunately, given that we're kind of coming to a close, I don't think I'll be able to resolve for that. Will the module be able to report measures to CMS? So we do have reports that can be exported and then provided to CMS. Yes, so this does produce the CQM reports needed to submit to CMS. Use putting time limits on med refills to ensure that patients come back for care. What would this do beyond that? Time limits on med refills to ensure. Okay, so you use med limits to. So I'd say that this can also. There are patients that aren't necessarily on medications who would want to come back for care for other reasons. For instance, if you have patients with a specific care gap who maybe don't have medications, but have some other need. And again, this is specific to your practice. If this is a family practice and you have children that are your patients, again, to use that immunization example. So I would say there's lots of other things outside of medications where you may want to bring your patients back in, or for instance, just patients who need annual physicals, right? You can, there's a query in the software to identify all the patients who are due for an annual physical. So you may have patients who don't have recurring meds, who don't need refills, who you could still want to bring back for care. So there's a number of other ways to define your patients, right? I have another one with audio difficulties. Mike, I'm not sure if you're on. I don't know if you're able to see the questions. It looks like, yeah, we have 2 people with audio difficulties, but yeah, again, I'm not really sure how to resolve for that. Looks like we're at 1 o'clock. Just gonna check my schedule and make sure I don't have anything. I think I can stay on the line for a few more minutes. This conference room is no longer active. This module is an add-on. It'll be integrated for use with version 10.1, but it is an add-on. Just gonna try to send a message to all. That's all for the audio issues. Will this webinar be available after the live cast? We did record. I imagine we will have some way to share it, and we are planning on doing more webinar sessions like this. So if you received an invitation to this session, and Tad specifically, I can take down your name and make sure that we include you in outreach for future sessions. But we will, if there's someone that you had in mind that you wanted to see the session, we will have further ones in which, at which time we can address any new questions. But I believe we will be I believe we may be able to distribute the recording. I'm just going to ask Mike about that. Okay, we have too many more questions. Oh, I just got another. So can you explain chronic care piece and how we earn revenue? So chronic care management is if you have a patient who is eligible for chronic care management, there isn't any, it's essentially you can bill out a code to Medicare for administering their plan every month for 20 minutes. So it's just like billing anything else. And the way that the software works is it lists out the patients who are eligible for chronic care management, and then if you enroll them, it gives you a list of every patient that you need, where you need to review and administer their care management every month, and then based on that list, you can bill them all out. Okay, and there's Mike sending a note. Yeah, so the webinar is recorded, and we will send it out after. Okay, I think we've got all the questions, and recognition of everyone's time constraints. We'll just go ahead and close it out here. But we're certainly happy to hear from any of you, and if any further questions or anything we missed, please go ahead and shoot us a line, send us an email. Thanks. Bye.